Okay. Hello, everyone. Can you hear me? Show me thumbs up if you can. Okay, you can. So my name is Mandeep. I'm a nurse anesthetist. And thank you, Simran, for inviting me to share my knowledge with you guys and tell more about nurse anesthesia. So my whole presentation is about like what I did, but towards the end, we will do question answers. You can ask me any questions and I'll be happy to help. And if I don't know the answer, I will find out and reach back to you, okay? So my presentation I named as Introduction to Nurse Anesthesia. So a little bit about me. So I'm married for the last 20 years. I have 2 daughters. I've been a registered nurse for almost 23 years. And I did the nurse anesthesia about 13 years ago. Except that I love to run, I hike, travel, and I'd spend time cooking with my daughters. So from 1996 to 2000, I was back in India and I did my bachelor's in nursing from University of Punjab. That's in northern part of India. The state is called Punjab, right? So after doing nursing over there, I worked as a nurse. And then to work as a nurse in US, I had to clear 2 exams. Those exams were nursing related. They were called the CGFNS and NCLEX. And to demonstrate my English proficiency, I had to clear additional exams, TOEFL and TSC. And then I was able to come to Boston and work as a nurse in Boston for 2 years. From there, we moved to Pittsburgh, Pennsylvania, and I worked as an intensive care unit nurse in neurovascular ICU, where you treat the patients with various brain surgeries or stroke, like those patients. And I worked there for 2 years. And from there, I went into master's in nurse anesthesia. And since then, I work as a nurse anesthetist. Most recently, last year, I did a doctorate in nurse anesthesia practice. And also a fellowship is called Acute Surgical Pain Management Fellowship from Middle Tennessee School of Anesthesia. So that's all about me and my education. So why to choose a career in healthcare? The biggest thing is the job security, because everyone needs the healthcare, right? But it's also a lifelong opportunity for learning, because everything is changing. You're always learning some new technology or a new research. There's a lot of flexibility in the job. You have flexible hours. So patients are in the hospital 24 hours, no matter it's a weekday, weekend. So you can adjust your schedule according to your family needs. So you can find a balance for your professional and personal life. And if you enjoy teamwork, a social setting is a perfect place to work. And you basically belong to a large trusted profession and you feel like self-satisfaction helping others every day. But there are so many career choices in healthcare. So you can be a surgeon, medical assistant, podiatrist, dentist, dietitian. I became nurse anesthetist, right? So, but you have various other opportunities as well if you want to choose any other career. So what is anesthesia? So anesthesia is putting human being or any animal into unconsciousness where you forget, you don't feel pain, and we can use medicines to help relax your muscles, but it's all reversible. So think about some person who got into an accident and fractured extremity like arm or leg. You want to fix the extremity, but they're in tons of pain. Nobody wants to remember that part, right? So for surgery, we give them anesthesia. They don't remember that part. We give multiple medicines. We take care of their pain. And some medicines, we work on the muscles. They relaxes the muscles and you can fix their deformity and you reverse all that and wake up the patient. So basically, anesthesia blocks the pain, awareness, and muscle function. So for that, person who's providing anesthesia, they become expert in managing airways, circulation, and smooth wake up of the patient. So where we provide anesthesia is provided wherever surgery is happening. It can be elective. Elective means it's planned. It can be trauma, like any of the accidents, or we go to like trauma hospitals, so you provide anesthesia, or is it curative? Curative means if some person is diagnosed with the cancer, so you want to get rid of cancer before it spreads to everywhere else. So for example, for breast cancer, patients get mastectomy, so then it's curative. Obstetrics is related to mother and baby. So there are two types of anesthesia providers. One has base in nursing and other have base in medical. So nurse anesthetists, there are about 50,000 in US, and their base is bachelor's in nursing, then 2 years of intensive care unit experience, and then 3 years further training in anesthesia. And they can work independent or in collaboration with the medical doctors. For anesthesiologists, they have medical base. They do 4 years of medical school and then 3 years of anesthesia residency, and then they can go for optional fellowship where they become specialized in further training. They can work independent, collaborative, or they can work in supervision environment as well. So in US, nurse anesthetists work in all the states. The states where the filling is green are called the opt-out states, and nurse anesthetists, they can work independent. So California is one of the states where nurse anesthetists are working independent. So they don't need any medical supervision, like MD doesn't have to work with them. The states which are red, like mostly East Coast, they want anesthesiologists to work with them. So who is nurse anesthetist? Nurse anesthetist is a registered RN who gives anesthesia to the patients for having surgery, delivering the baby, or receiving trauma care. And these nurse anesthetists, they become certified when they take a national exam after completing a graduate degree program. So basically my whole title is Certified Registered Nurse Anesthetist, or simply CRNA, or most recently the term approved is Nurse Anesthesiologist. So it's easy to understand for the patient, like what our job responsibilities are. So basically we are advanced practice nurse professionals. So what do we do? So we take care of patient before, during, and after surgery. So we use various type of anesthesia drugs that help the patient to forget about the surgical experience, take care of their pain, and help relax the muscles. We help mothers for controlling their pain and helping them deliver baby comfortably. So who should become a nurse anesthetist? So if you're a great team player, you would like to love in the healthcare setting, overall goal is the patient well-being. So if you like to specialize in nursing, you enjoy critical care, you enjoy science, math, and pharmacology, and you like to make important decisions, so then Nurse NC is for you. A person who is confident enough to make critical, independent decisions, enjoy to work with cutting edge technology, and is comfortable being trusted upon. Whenever we take care of the patient, so we become their eyes and ears. So patients, they kind of put trust in us. So at that time, we are 100% present with them. So if you want to be a person that people can count on you, that you will protect them for providing a good anesthetic, you are the person needed for anesthesia. So these are the 4 important roles we provide as a nurse anesthetist. So we act as we practice in clinical, we act as an educator, researcher, and administrator. So in clinical practice, we go to the patient, we talk to them, do the assessment, and develop our anesthesia plan of care. And we can administer anesthesia, is called sedation. For example, if you go to the dentist, they provide you different type of anesthetic for your teeth so they don't hurt. And some people, they can stand it, they want to be completely under anesthesia, so we can provide that. For mother and baby, labor pain relief, resuscitation services, and acute and chronic pain management services. So those all fall under clinical practice. Nurse anesthetists also play a very important role in the military for providing trauma care services. We act as an educator, not only for our students, but also for patients, community. And we go to, we have a nurse anesthesia school in Oakland. I personally go there as well and participate in different simulations. And students come to our hospital. We work with them and teach them in our hospital as well. So we act as researchers. So when I did my doctorate, we did our studies, we collected data, we had a clinical question, we did a lot of research and then recommended what should we do to make our education better or our clinical practice better. Some of us who are at a higher post, they can help with the healthcare policy. They can be, they can play a role in the leadership as well. So when you're in leadership role, you provide your specialty services from point of in obstetrics, orthopedics, cardiac, from anesthesia department. So how we can make a good experience for the patient from anesthesia perspective. And then comes the salary and the schedule. So CRNAs are very highly respected for their work. And according to US News and World Report, they are ranked number 10 best job in 2023. And we are considered as highest paid nurses. And our pay starts from like 200,000. It all depends if you work independent or not. Some of us are making like 300,000 plus. So CRNAs can work 8 hours, 10-hour shifts, 12-hour shifts, or some of us work 24-hour shifts. It depends on their family and work schedule preference.
It's your office.
So for our high school students or who wants to go in nursing, these are the prerequisites they look for when they want you attend the nursing school. They include like anatomy and physiology, psychology, sociology, algebra, statistics, diversity and culture, pathophysiology. Those are the prereqs for your nursing. These are my references, and this is all what I was able to put together, but I'm open to questions if you guys have any questions. Any of you guys want to go in medical care? Or would you like to come and shadow us, like what we do in our, so I work in Kaiser Permanente. Would you like to come to our hospital and shadow and see what we are doing?
Yeah, I think that would be a great experience for anyone who's interested into the medical field. Does anyone have any other questions? Oh yeah, I see something in the chat as well.
So if you want to become an anesthesiologist, you do the same work. So basically you take all the courses, then you do MCAT, go for 4 years of medical school, then 3 years of your medical anesthesiology residency, and you become an anesthesiologist. And you will have little more loans than nurse anesthesiologist. That's gonna be the only difference. But you will make more. You understood.
All right. Another question for you. What are some of the harder sides of working as a nurse anesthesiologist, would you say?
Yeah, I would say we work with across the lifespan. So our patients are kids, adults, old people, moms. So sometimes we get super emotional with the patient. So those feelings stay with us. Like we come home, then we need to use some methods how to disconnect. Sometimes we get like it's called like compassion fatigue or something. Like you get so much connected to the patient when you come home, it's hard to get rid of those feelings because so for example, during COVID times, we were the main people up front. We were using the airway tubes when patients were not able to breathe. But then all those feelings were also coming home because there was no vaccine available. And no protective devices were available. So sometimes having a disconnect from your professional life and family life is a little tough, but in the end, every day you have gratification. Like every day, whenever you do something good for somebody else, you took a good care of a patient, you took away their pain, is immediate reward. So every day you come back home, you feel good about yourself that you did something good for someone.
That's very interesting to hear about. And another question from the chat is, which hospital are you connected to if there's anyone interested in shadowing?
Correct. So right now I work at Kaiser Roseville. But before this, I worked at University Hospital. I worked at University of Pittsburgh Medical Center. And then I also worked in County Hospital in Stockton. But my most recent is Kaiser Roseville. And I do volunteer for teaching in Nurse Anesthesia School in Oakland.
That's great to hear about. And then one last question from me for you is, do you have any memorable experiences while working on the job as an anesthesiologist? Like anything memorable or like a favorite experience that you have in mind?
My best experiences are when we have little kids. So most of the times our goal is to take them, like separation anxiety, when parents put full trust in us, like we'll take care of them when they're like 6, 7 years old, when we take them with us and they come back and they're all pain-free, and we ask parents to come back and show them that how they're nice and safe. Those are my best experiences. Like I cherish them every day. So taking kids from the pre-op, so before surgery, to the surgical suite without having them cry, and giving them anesthesia and bringing them back without crying, I feel accomplishment in that. So that's my immediate reward.
That's amazing. And then one last question is that, or not necessarily a question, but what does your day-to-day life look as an anesthesiologist, like from morning to night? What generally? How does it look?
So most of the times when we show up, our so for example, for me, I know my schedule way ahead. So I do some 12-hour shifts, some 8-hour shifts. So if I'm doing 12-hour shifts, I work from 7 a.m. in the morning to 7 p.m. So I leave home around 6:15, 6:30. I'm all ready to start my work at 7. And we bring first patient in the OR around 7:30, 7:45. And after that, it's one patient at a time. You take care of one patient and one patient at a time. Every patient is different, their background is different, how we plan their care is different. After that, it is all based on like who all are our patients. And sometimes to feel more prepared for taking care of them next day, we try to look them up before. So how they are, how we can take care of them. And the other part I do is labor care, like obstetrics, where babies are being born. That's the best area to work. When you get rid of all the pain with the epidurals and the little babies, those are the best moments of life as well to participate in.
Amazing, yeah. Another couple questions from the chat as well. What type of patients are situations where the most difficult for you to handle? So what patient, do you have any?
Yeah, so for us, the difficulty comes when we have to put the breathing tube in. So we take the patient back in the OR and we have to stop them breathing and then put the breathing tube in. So at that time, you need to have 100% trust on yourself that this patient will stop breathing and I will put the breathing tube in and will give them the breath. So those are very critical moments in our life. So every patient is different. So if they are very big, if they are like maybe 350, 400 pounders, putting the breathing tube in becomes challenging. So at that time, you need more critical skills, other airway devices to manage their airways. So those are the critical moments when we are 100% present and we want to do our best. So which are the good colleges to attend for anesthesiologists? So some of my anesthesiologist friends, they went to UC Davis first, and then they're like top colleges everywhere, but the most I know, University of Pittsburgh was very good one, in Chicago, UPenn, UC Davis, here in San Francisco, like anywhere you can find, if you keep up your grades good and you're able to get into a good medical college, and then you will, the most important I would say is keep your grades up, but also take care of yourself. It's not all about grades. You need to know how to handle stress. If you can handle stress, no matter whatever situation you are in, you will be able to handle. So having good grades is important, but ability to handle stress is same important, because all these fields, the medical field, the more you're taking care of other person, other human beings, more responsibilities being put on you. You need to take care of yourself before you can take care of others. So that's what I would suggest, like have some hobby, exercise, or talk to somebody, but handle stress as well. All these jobs are highly paid, but they're stressful as well. So handle stress, keep your good grades, have a mentor. If you don't know anybody, try to connect with someone who knows and they can guide you. So Simran, I think I really admire you having this, because when I came from India, I didn't know who can I ask. So having good mentors is very important. So if you want to become an anesthesiologist, try to find a person who is an anesthesiologist already, and try to shadow them, ask them what they did, where they went, and a lot of questions will be answered.
Thank
Do
you.
you
Yeah,
take-
thank you again for presenting with us. I guess this is the final four for anybody who has any other questions.
Are you accepting anyone as mentors right now, Mandeep ji?
I can tell all about nurse anesthesia, but for anesthesiologist, I need to talk to my friends if I can help you guys connect with someone.
All right, if there aren't any other questions, maybe you could put your contact information in the chat for anybody who might want to connect with you after the meeting. But other than that, thank you everyone for coming, and it was amazing having you all here. And thank you for presenting as well. It was an amazing presentation.
Yeah, I'm here, but don't feel yourself that you are alone. All I can say, if you're thinking about something and you need help, help is always available. So try to connect with the right people. There are always people to help you out. Find mentors, do your best, handle stress well. Those are the major things I can say.
All right, thanks everyone. And thank you for coming. And I hope to see everyone at the future guest speaker events that we hold as well.
Okay, perfect. Thank you so much, Simran.
Thank you.